try not to bump this. We move it
Oh
away,
my
please.
God.
Hello. Happy Sunday, everyone. Thank you for joining.
And we're live.
We're live. We put up a post earlier this week
Yeah.
looking for questions from you all just to get things started. Feel free to put things in the live chat.
Yes.
Little update on where we are at. We are in pregnancy number 2. You guys followed us through pregnancy number 1 and through the first almost 2 years of our first kiddo's life already. And we're in the 3rd trimester of baby 2.
Yeah. And we're excited. It's just he's going to be here before we know it. And I think more chaos will ensue.
Yeah, absolutely.
Because
So,
Cease continues to be a 2-person job. So.
Yes, we've been learning all of the fun things about having a toddler and working through starting potty training, and we've done feeding and all of those things. But
yeah. So this says slow mode is on. What do you think that means?
I think that has to do with how often people can send questions.
Hi, Arena. Do we know how to change that?
No, just leave it. That's good.
Okay.
Anyway, this is, I think, our second live, so forgive us for how naive we are in this. But let's start out with some questions. We got a ton of questions.
Yes.
Let's start. Well, so thinking about having a new baby and going for delivery sometime soon. Crystal said just a couple days ago, could you talk from a pediatrician standpoint about newborn screening? I'm due in March and would love to know more about what to expect at the hospital, as well as first 2-week appointments, what testing is done, what changes will my newborn go through in 2 weeks. So a lot there, but some basic things, and we'll kind of go, I think we're going to do an episode on this in the upcoming week, just as we do it with our own baby. First things first is when the baby comes out, we want to see how is that baby transitioning to the world. The nurse in the room there does something called an APGAR score. This is kind of giving a basic score from 0 to 10 about how well they look from a color, how vigorous are they, are they breathing well, what's their heart rate, etc. And kind of most babies come out between 8 and 9 is going to be their score. And then they're going to get a newborn exam from a pediatrician sometime in the first 24 hours.
They say they only give APGARs of 10s to pediatricians' kids.
Yeah.
That never happens. I don't know what Cease got for hers. I think got it 9 or something. She didn't even get a 10.
Yeah.
So don't freak out if you do not get a 10 out of 10 on the APGAR.
Yeah. And then the big pieces of most of the newborn screening kind of happens right at 24 hours of life. That's where they do a newborn screen, which is a little blood test. They prick the heel and get a small blood spot that they're able to send off and test for more than 50 different genetic diseases that are there's something that can be treated, and sequelae from those can be prevented.
And that varies from state to state how many they test for.
Yep, but generally at least 50 depending on which state you are in here in the US. And then there's also a congenital heart disease screening test that's done at that time, United States wide. They just look at that saturation in that little right hand and then one of the legs and look for a difference in overall saturations. And then big things at your appointments when you go home to see your pediatrician in those first 2 weeks. The first visit is really just making sure you guys got home and feeding is going well. And then generally there's a 2-week visit, if not sooner, that it's a good time to check for weight, see how things are going, see how mom's doing.
They do a hearing screen in the hospital too.
Yes, absolutely.
I think we talked about that in our kind of what to expect at the hospital video, which we can link it in case anybody's watching it after. But that first 24 hours in the hospital is a lot happens. And it's right around that 24-hour mark that everything really happens. Where they're now it's time to go out, do all these screenings. We check the bilirubin, we prick the heel, we do the congenital heart disease, we do the hearing screen. Sometimes you can go with your baby, sometimes you cannot.
We didn't. I think oftentimes they like to just take them, and it was fine.
Yes.
But we'll try to put all that in the video itself for you guys if you want more information.
Because it is a lot.
Okay, awesome. Thank you all for your comments already.
Hi, everyone. Yes.
Quick one, XOXLove143 XOX says, what is a great resource for learning starting solids? We actually did a video all about that. Talked about our favorite resource was something called Solid Starts.
Yes.
And so please go check that out.
They have an Instagram where they provide tons of free content. You can do a paid some kind of subscription thing to get access to their whole food database, but they have tons of free stuff online and on their Instagram that we felt was very helpful. We did some starter things in a couple videos about baby led weaning. So
awesome.
Yeah. What else do we have thoughts on the owlet sock? And I saw that in a question that got asked as well. Someone asked about the snoo and the owlet. So we'll let the pediatrician lead.
Yeah, so in terms of what they do, the outlet sock gives you this ability to continuously monitor oxygen saturations and heart rates while you're home.
Right.
I will tell you, Sarah asked me if we wanted this for our own child the first time through, and I said no, absolutely not. A lot of times, unfortunately, they are a useful tool and can be useful, but the problem is
They're not hospital grade, number one.
Yep.
So you run this risk of false alarms, which is terribly anxiety and a terrible experience from what I've heard from moms who've had these few false alarms, like sock comes off, whatever.
Yeah. The question is like, if it goes low, is it because it's a reading error or is there actually low saturations? And it just gives you lots of information that you don't necessarily have all the tools to know what to do with.
Right.
And so for us, what we said is, she's healthy. She's doing all the normal things.
Mhm.
She slept in the same room as us until she was 4 to 6 months, which is the AAP recommendation.
Mhm.
And so for us, that was enough. And we thought kind of having an extra alarm in the house was just going to be more cause for anxiety.
Yes, I do not think it is something the AAP recommends. But the other thing to keep in mind is, your heart and like your own special flavor of anxiety. We all have it. And so you're probably going to know like what's worse is that, 85 or whatever percent of the time when you look at it, it's probably fine and that helps you. Or does that fear of a false alarm, is that going to be worse? So think about it, talk to your pediatrician about it. There's not a wrong answer.
Yeah.
We didn't go that route, and that's
up to you.
Yep.
If your child does need oxygen saturation monitoring at home, there are hospital grade monitors that you can get for whatever various medical condition that has an issue. But for us, we decided not to go with the outlet.
Someone else asked about the snoo in the comments question on this week, and I have a lot of mom friends that love it, love it, love it. Think it's the greatest gift to infant sleep. We did not use it. It's very expensive. Like it's $1,000 or $1,200 or something for a bassinet that you can use till they're 6 months old. And so we did not make that purchase.
Yeah.
We kind of said we
ended up becoming this new.
We
did a
snoo.
lot of like baby rocking or like sitting by the bed slowly, like, rocking her to sleep until she would fall asleep. But
we did do taking care of babies, like newborn sleep class. We watched that because turns out we actually didn't know anything about sleep or newborns, as you all have kind of gone through that journey with us. Thought that was very, very helpful.
Yes. And we've tried to share most of that information, what we learned about sleep, nighttime sleep,
newborn
and naptime sleep.
Sleep training,
Yeah.
all
so
that.
We got 3 sleep videos that you can check out. I will say we got a couple questions about sleep this week too, in terms of like transition from nighttime sleep to daytime sleep. And each step is a little different. And even someone just asked if you can spoil your baby with contact naps.
Oh, no, you can't.
No. Definitely there's a point in terms of like you want your baby to be able to learn to fall asleep and stay asleep on their own for nap time. I can say we got into this stretch somewhere around like 6 months of age where like she would sleep for about 45 minutes and we could go in there and pick her up and like she would cry and she would sleep for a little bit longer.
For longer naps during the day.
That is kind of a parental philosophy that you can choose what you want to do with that. If you want to say, hey, they're like either need to be able to sleep on their own or not, because maybe you've got other kids in the house or other things that you just can't be in there to do.
Right. And so in terms of like, can you spoil a baby? The first like 4 to 6 weeks of a baby's life is really just about you surviving, figuring out your baby, getting to know your baby, getting to know you as mom or mom of 2 or whatever, or parent of 2, or 3 or so on. And so babies just came out of the womb. They've been hugged, part of you for the last 9 months. That is something kind of 4th trimester that babies love. They like to be swaddled. They like to be shushed because they've had that placenta in their ears and they want to be on you and warm. And so you're not making bad habits with your 4 to 6 week old baby. Don't even just snuggle your baby, smell their sweet little head, to enjoy all those sweet, sweet naps holding your baby. We started thinking about sleep habits and some like sleep hygiene things for babies around like that 6 to 8 week mark. Because that was kind of what Kara said to do. And we're like, we're going to follow this religiously. And it really helped.
And what do you mean by that? That was where we kind of had more of a set schedule for things, or what kind of things do you think about when you talk about sleep hygiene at that time?
We kind of tried to have a routine. We really were thinking about wake windows and naps and just having a flexible routine is kind of what we tried to do. I think starting around that 6 week mark.
Yeah. And then by flexible, which means we were pretty consistent with like wake windows and times of naps and even bedtime routines before bed too. And like you will find your child gets so much just comfort from saying, hey, at the same time every day, roughly we do the same things, helps them with transition from one thing to the other, helps them get on the schedule.
And I just looked up wake windows again because I was just like, what did we do? I don't remember anything about the newborn phase. What's going on? So wake windows from 0 to 4 weeks are 35 to 60 minutes. Okay.
And that's a time from when they wake up to a nap until they feed, and then the time that they're ready to go back to sleep again.
So from the moment that sweet little brand new baby opens their eyes till the time they're ready to go to sleep again, right at the beginning is 35 to 60 minutes. 4 to 12 weeks is 60 to 90 minute wake windows. 3 to 4 months is 75 to 120 minute wake windows. 5 to 7 months, 2 to 3 hours. 7 to 10 months, 2.5 to 3.5 hours. 11 to 14 months, 3 to 4 hours. And then 14 to 24 months is 4 to 6 hours. This is free taking care of babies resources. You can Google online. I have it saved on my phone because I am ready. So I'm ready here for the next one. But that really helped us because we just didn't realize it was a thing.
Great questions.
Was very important.
A couple of pregnancy related questions. Alana Middleton asked, I have hyperemesis gravidum in my first pregnancy. Is there something I can do to prevent it for my second pregnancy? Any helpful information?
So sorry you were so sick. It's throwing up sucks, and then you do it for weeks and months and it's terrible. So knowing ahead of time that you had it in your last pregnancy, you're going to be hyper aware of it happening again. Of course, the general recommendations are, be in touch with your OB about this. Every pregnancy is different. And so maybe you will dodge the bullet this time, but the thing, I know that you tried all of these things, and so I don't want to insult you, but little meals throughout the day, whatever, literally have a bagel or crackers or goldfish before you even get out of bed in the morning. Get something in your stomach. Try to keep food in your belly all day, just a little bit. Sometimes sour candies are better, lemon, ginger, different things. Taking vitamin pyridoxine and Unisom. It's when they put it together, it's called diclegis. So that's something you can try. And then the other thing, of course, to keep in mind is there are some medications that you can take that are prescription that are safe. I don't know if you tried that in your last pregnancy, but I mean, I've had patients on a Reglan pump before in the hospital because they were so sick, doing steroids and different things to try to help if you are losing so much weight and really can't keep food down. So the goal, of course, is to get ahead of that and try everything else, because you can really get in a bad cycle where you are now losing weight, you're dehydrated, we're worried about your electrolytes. And so my pro tip for the next one would be try to have a plan of attack before you even get there. Just be like, hey, I know this could be coming. Have some Zofran in your cupboard and see if we can.
And I think actually Joyce Ashley just commented, kind of following this, starting meds early versus later upon symptom onset really helped my best friend in her second pregnancy, which goes to say, talk to your OBGYN sooner rather than later. Right. Get that help sooner. Because
you don't want to get behind. You don't want to be in this vicious cycle. We want to be a little bit proactive and preemptive and try to get ahead of it. Because once you're in that cycle, it can be really, really tough to get out.
Yeah. Someone else asked our opinion on blackout curtains. Absolutely. Get them. They've been so helpful for nap time or going to sleep when still daylight outside.
Yes. It does
for the baby.
Really help them with just being in, I understand this is nap time. It's dark. It's cool. I have white noise. I have some dark. And so we have found it very helpful. Like when we'll go to my parents or something, we literally have like some piece of dark cloth that we
Like
hang
a thick,
up.
thick blanket.
It doesn't have to be anything fancy. We've push pinned blankets up to a window before.
Like if we went to an Airbnb, actually, like
We're like,
we
we
need to
gotta,
get blackout curtains,
this
so we
needs
just
to
use
get
a
darker
thick blanket.
or our kid isn't going to sleep well. So yeah.
Do you, I feel like there's been a couple questions about preparing for delivery. There's a question here from someone was just mentioning they had a third degree. Katie Benda says, if I had a third degree tear with my first, am I more likely to have it again with my second? Do you want to talk a little bit about like preventing perineal tears and like preparing for giving birth?
Yes. So we do have a great video about the limited data on things you can do to prevent perineal tears. A third degree tear is, a significant, an oasis injury, obstetric anal sphincter injury. And it's not a fun thing to recover from, as I'm sure you know. And so would recommend with the next pregnancy, trying some of the things, the perineal massage, some other stretches, things like that, and talking with your OB about it. Second pregnancy, second deliveries, generally, your tissue has just stretched from the first time. So often tears are not as bad. But of course, you want to do everything that you can to prevent that. And sometimes you just can't. Your baby comes out with its arm like this, or, they are little angels, but sometimes as they are exiting, they wreak some havoc. So we often talk about women who end up with a fourth degree tear. There is a significant discussion usually we have with your OB where we would offer a primary C-section, or just choosing to say, hey, you had significant injury last time. Let's talk about risk versus benefit of doing a C-section instead of risking that again. So talk with your OB, see what they feel. They know your anatomy better, and can give you some thoughts on what way to go. Generally, next time things have been stretched before, so it goes better.
Awesome. And check out our video all about preventing perineal tears.
Yes.
I think we called it preventing tears in pregnancy.
And everybody's like, preventing tears?
Yeah.
Preventing crying.
Yeah.
I was like, well, yeah.
You might cry.
Yes.
A couple really nice messages. Ariana Alvarado says, I love you both.
Hello.
Celeste says, thank you all for your videos. It's so helpful following you all the way from South Africa.
So
awesome.
Fun. We sometimes forget. It's like a global little family we have here on the YouTube, and it is so fun.
Yeah.
Hearing your stories from wherever you are in the world, and hope that your pregnancies and new little babies are going well. We did get there were some awesome questions in that community post as well. One of them was tips for dealing with anxiety around miscarriage during the first trimester. I'm 6 weeks now and don't have my first appointment until 9 weeks, and the waiting is driving me crazy. Totally understand. I think the thing that helped me and helps me reassure patients is kind of the numbers. Just statistically speaking, the risk of miscarriage changes by gestational age. And so at the around 4-week mark, there's about a 20% chance that, things don't go well and you end up having a miscarriage. By the time you make it to 6 weeks, you're looking at a less than 10% chance of miscarriage. Once you get that ultrasound where you see that little fetus, little crown rump length in the uterus with a little fetal heartbeat, we say you've got about a less than 5% chance of miscarriage. Once you hit that second trimester, 14 to 20 weeks, we say it's about a 1% chance. And then after 20 weeks, it's less than 1. So I think knowing that the risk is very small once you get to 6 weeks, less than 10%, is helpful. The other things that sometimes surprise people are some people start feeling super sick, sore boobs, feeling nauseous, feeling sensitive to smell or heat, or have all these different symptoms. And that can be oddly reassuring because you're like, well, I feel like garbage, but it means things are happening. On the flip side, some women don't have symptoms at all. And that can be pretty nerve wracking because you're like, well, is anything happening? I have no idea. That was kind of the boat I was in. I was just like, well, I have no, you have no idea. You're not at a point where you're feeling fetal movement. You're not throwing up and you're like, this is great, but also very nerve wracking. So no, normalizing that as saying, hey, this is normal pregnancy anxiety. I always say normal anxiety with this. If it's affecting your life, if you feel overwhelmed, then it's time to talk to your OB and talk to, do you need to get in for an earlier ultrasound? Do you need to be on some medications to help you manage your anxiety? Do you need to talk to someone? Pregnancy anxiety is a very, very common thing. Postpartum anxiety is on this postpartum depression spectrum, and it's something we keep a really close eye out for. And so plug yourself in to your resources, talk to your friends, talk to your OB, and get the thing that always helps me is knowledge. Knowledge is power. Do a bunch of reading, find a great pregnancy book, watch all our YouTube videos. I always find that being the more knowledge I have, like the better I feel about things. And so those are my pro tips.
Yeah. Awesome. Couple of just fun comments. Mitt says 20-week check-in ultrasound tomorrow. Yay.
So
good luck.
fun.
Have fun seeing baby tomorrow.
It's so fun.
Michelle says, went through my first pregnancy when you were pregnant with Cease, now pregnant with number 2 as well. Pregnancy twins.
Whew.
Yeah, that's
Well,
fun.
Here we go.
And then Nicole from Scotland says, I watched you guys from the start. We started trying around the same time. Had her daughter October 2021 and now pregnant with the second in June. Any tips for 2 under 2? Gosh, we will let you know. We are preparing. I will say so we're in 3rd trimester now. She's in the 3rd trimester now. We've been doing a lot to try to prepare our current toddler, who's not 2 yet, for having a little baby brother.
Yes.
We got her little doll that is her baby. We work on we've got lots of little books about being a big sister, about being helpful, as helping with bath time and pushing the stroller and getting wipes and diapers.
Yes.
It's also incredibly cute because I can say hey, where's your baby brother? And she'll run to Sarah's belly and kiss the belly. And so we are trying these things. We also think we're going to have a lot of issues with jealousy. And I think from our unexperienced thoughts on what we're expecting is we're just expecting to have issues and that it will take time, patience, and consistency.
And that's normal. She is a little human who has her own thoughts and feelings and emotions. And she has to learn how to work through that. That's being a toddler, I think, in general. She's kind of sick right now. And you can tell she feels terrible. And it's hard for us to process that. And as an adult, when you don't feel good and you can communicate how you feel. And so there's just a lot of supporting her as she has little hard times. And I think we will continue to do that.
Even we've got some good friends who have an almost 4-year-old and just had a second, and they're dealing with a lot of jealousy issues and even taking time to be intentional about, hey, we've got alone time with the older child with one or the other parents while the other one's taking care of the other one, and still trying to find that special time. That will be a goal for us to do with all of our children as they grow, to have some special time kind of one-on-one where they set the rules for their interactions with mom and dad.
Yeah, but we did also I feel like we set some things up early. It wasn't actually earlier. It was quite delayed compared to the first one, but I was like, we should set up the crib. We should set up put the car seat in the car. We should do all these things so we can start talking about baby brother and these different things and trying to incorporate him into our life now. So it's less of a surprise for her. I don't know exactly how much a 2-year-old grasps, but she's getting used to it. There's a new crib in the house that she just put a teddy bear in today, and there's a second car seat in the car. And so trying to help her do that. And then the other thing that we heard from a friend is baby's going to bring home a gift for her. So there's
like, oh, I think she's getting an outfit and like a toy or something when baby comes home. And it's like, hey, here's your little brother, and he brought you
And
something.
he brought you
Yeah.
matching. I got him a pair of matching.
We'll keep you
pajamas
posted on
on
how
things that
this.
are helpful.
Yeah.
I'll do some.
We have no clue. We
research on it.
are anticipating chaos though. Cool. What about around Sweden says, is it okay to work out while feeling nausea? I'm assuming during pregnancy.
Yes.
Especially if bleeding a little.
So if you're bleeding, it depends on gestational age. And if you have anything else going on in terms of contraindications. So there are some reasons we say, hey, pelvic rest, got to take it easy on exercise. These are things like placenta previa. If you've had some prior abruption, sometimes short cervix or different things, we say, hey, we want you to take it easy.
These are risk factors for exercise in pregnancy. Is that what you're okay?
Yes.
But otherwise, exercise in pregnancy is strongly encouraged.
Strongly encouraged.
Okay.
If you're feeling nauseous, generally you're going to have to know your body. Does going out for a walk or a bike ride make you feel a little better? You get some fresh air, you get your blood flowing. Maybe that makes you feel better. Maybe you're like, I can't do this walk. I need to take a nap. So that is one you want to gauge. Generally, if you're having bleeding, I would say take it easy for a couple days until that bleeding stops. Not because exercise is affecting that, just because I never want patients to look back and wonder, oh, should I not have gone for that bike ride? Did that have something to do with my bleeding? Is any of this related? And so with bleeding, I'd say just take it easy for a day or two until that bleeding stops. If it doesn't, it's something you want to talk to your OB about anyway. The nausea is one. Try it. Go get some fresh air, go for a walk, see how you feel. If getting moving makes you feel better, wonderful. If it doesn't, you are pregnant and you absolutely deserve a nap. So, let's see.
Okay, a couple other questions. Chelsea Flannery says, could you guys talk about viability week? She's currently at week 22. So I think this is like how far does baby need to cook before, if they were born early, that they would have a reasonable chance of survival? And so
this depends on where you are.
Depends on where you're at, where in the world, and even where in the U.S.
Yep.
What size NICU, neonatal intensive care unit, would be available to you if baby comes early. I can tell you, when we did our subspecialty training for fellowship, we were at the University of Iowa, and they have an outstanding neonatology unit that has some of the best survivability in the world, actually. And I had a patient that I followed in my pediatric cardiology clinic who was born less than 22 weeks gestation and had almost no long-term sequelae. He was on at 9 months of age, he was on room air, no major eye issues, no major other issues.
Rarer.
Which is a very rare chance that happens, but it does happen. The general standard is 24 weeks gestation is generally considered viable. That 22 to 23 weeks here in the U.S., there are centers that will offer resuscitation to those babies that are born before that 24 weeks. And depending on the center you're at and how often they do that, they're just better at that. Japan is famous for offering resuscitation to babies before 24 weeks, and they as a nation are very good at that as well. And so kind of depends on the center and their expertise and experience with babies that come that early. Generally, in terms of like morbidity-free survival, so meaning that you don't have long-term lung issues, long-term issues from brain bleeds or eye development,
or gut issues or different
gut issues, the risks of that drops significantly if you make it to 28 weeks here in the U.S. But
so it very much depends on the hospital you're delivering at, the NICU that the level of NICU they have. Most of the time, at this point, your OB GYN team is going to counsel you if you are in that 21 to 23 week range. They're going to have a long discussion with you with maybe the high risk OB doctors. They will ask the NICU to come and talk to you so you can understand risks, mode of delivery, and different things like that. Generally, really around that 22-week mark is when they are starting to think about offering steroids,
which helps with the lung development and some other things that, like, if when baby comes early, what can we do to help baby have the best shot at having a meaningful life without significant illness and complications of being born early?
Peri-viability is a
really tough,
incredibly challenging.
And I think the challenge for those parents too and those babies is you're signing up for a very, very long hospitalization that like doesn't have guaranteed survival, and sometimes the scarier thing is that survival can come with significant complications of prematurity, whether it be lung issues, brain development, brain bleed issues, eye development, etc. And so this is something that really it depends. Like talk to the OBGYN team.
And it depends on you and your little fetus as well. Maybe male versus female changes prognosis. The size of your little baby at that 23, 24 week mark also affects prognosis. So many things. Generally, when we hit 24 weeks, we're like, well, we're viable. Was our
and then when we hit 28 weeks, like at least I was like super excited that it's like, hey, like our risks of like significant issues in the NICU drop kind of precipitously no matter where you are in the US with that. So.
Yes, I did see a question up a little bit that I wanted to touch on. Someone said, hey, I have a low-lying placenta, and at my 20-week scan, I have to go back in for another scan at 30 weeks to make sure it resolves, or I'm going to need a C-section. So and what are the chances that this persists? So just to touch on that, so your cervix is kind of like the neck of the uterus, right? This is how baby's going to exit. That cervix will dilate.
Baby's up here.
Yeah, baby's here. This seals the baby in. It's nice and long, usually, and so that's your cervix. The placenta can attach in multiple places. It can be at the top of the uterus. It can be at the front of the uterus. We call that an anterior placenta. It can be at the back of the uterus. We call it a posterior placenta. It also can end up being over the cervix. It can be over the cervix completely. That's called a placenta previa. It can be kind of near the edge of the cervix. We call that a low-lying placenta. As the uterus grows, this placenta will continue to also grow up the uterus as it grows. And so most of the time, these low-lying placentas resolve by mid-third trimester. There's some different studies that say only rarely, like 2 to 5% of the time does that persist. So the chances that low-lying placenta resolves for you by mid-third trimester is very, very high. So I know it's nerve-wracking because you want everything to just be perfect at that 20-week scan, but just give it some time. There's a very, very good chance that as your uterus grows, that placenta is going to move away from that cervix.
Yep.
Okay.
And that was Kristen Kirkpatrick. So thank you for that question.
Yes, great question.
Let's see. I think I saw a couple questions that I think will be great for you. Someone asked, this is Maddie Franken says, what is the best breast pump brand? And you did a lot of videos about breast pumping the first time around.
And so I'm not...
You tried the Spectra.
There's some awesome breast pumps
LV,
out there.
The Willow, the Baby Buddha.
I tried a lot of things. So the thing you want to find is a good base pump, and kind of the two very popular base pumps out there are a Medela and a Spectra. They're, the Medela is this yellow thing. Spectra is white with a blue or pink thing on it. You carry them around. It's like a sturdy
thing you plug into the wall usually,
or battery powered.
Okay.
But those are kind of what we consider a base pump. Those are the two most popular ones, I would say, kind of on the market. And they're often covered in some respect by your insurance. Okay. You want a good base pump. They have lots of adjustable options for suction, for speed, different things. And often they empty the breasts best. Okay. Which is really, really important. You need to have a good base pump. These other wearable options, which there's just flooding the market. There's so many brands like Freeme,
Willow,
Mom
LV.
Cozy, Willow, LV, all these different, so many brands, Baby Buddha, different things. They're great in terms of like, they get you through a day at work. They often don't empty as well. And if you're breastfeeding, is a supply and demand thing. So if you pump and you don't completely empty your breast, your brain says, oh, we don't need that much milk. So you do that for a couple days and you're not completely emptying, and your brain says, oh, well, we don't need to make that much milk anymore. It's been getting left in the boobs. And so it's very bizarre concept, which I didn't understand either. It's totally supply and demand. Your boobs are never completely empty. Okay. And empty boobs fill up faster than full boobs. So I literally remember with Cease, I'd be like, no, you just go like walk her for 15 more minutes. I want to let the boobs fill up a little more before I feed her again. It's only been like an hour and 10 minutes or something.
But you get most of the production happens in the first hour. Right?
But not even that. It's just like, it's a constant, it's telling your brain, if you put them back on the boob after 30 minutes, it's telling your brain you need to be making more milk constantly. They're always making milk. And as the boob fills up, then it's not filling up as fast because it's like, well, baby doesn't need this. So it's to back to your pump question, find a good base pump, a Spectra or a Medela. I have lots of videos about the Spectra because that was what I used and felt it was a great pump. And then you can play with some of these other wearable options if you want to try that. Willow didn't work for me. The LV was okay. Like Baby Buddha at the end sort of worked. It requires some playing around. And a lot of times I had a Spectra at work and I hooked it up and said, I'm just in timeout here for 20 minutes. And I'd sit and I'd chart and tried to be present because I had no shame. And so base pump, and then kind of investigate some of the others. I have a video on the Willow versus LV. I want to try the Willow Go this time around because it's just a different kind of suction. The Willow is a constant suction as opposed to the traditional. Anyway, get a great base pump and then pick one of those other ones to put on your registry maybe for your baby shower because it is nice to be portable, but it should not be your every day, all the time pump.
Yeah, awesome. There was a nice comment. I just lost it. Someone was asking, how do they get their very, very picky eater to eat something other than chicken nuggets? Oh, Pamela Crandell says that. You have our sympathy. I was just going to say, like, any success we've had with feeding, I think we were intentional, but I have no clue how much of it is us and how much of it is just the child, which
now she like pizza.
Yeah.
What do you want for dinner? She's pizza.
Yeah. Cool. Things that we did that we think helped. Granted, this isn't going to help you as much, but we started with lots of wide variety of foods early with our baby-led weaning. We talked a lot about that in a video about starting solids for babies. The other thing is just realize that you have to offer a food many, many times before they're going to like it often. So just keep offering new foods. Don't just put a couple different options on a plate and let them choose. Keep exposing them to other foods. I can tell you our little girl loves meat with dip. So a lot of ranch dressing gets used in our house. I think the biggest thing is continue to offer vegetables and fruits and just whole foods. If you can cook at home is even better. The less processed food, the better. Trying to avoid lots of sweets and trying to give them more of a basic palate. Now, having said that, lots of toast gets cinnamon sugar at our house too. And so again, just keep offering.
And when they're hungry, they will eat.
Yeah.
Okay. They will eat.
Someone asked how many hours of sleep we get as working parents. I would say that definitely depends on season of our baby's life. I can tell you when she was new, it was
work
and we were working. It was tough because we were we'd do work after she went to bed late, and then she'd wake up a couple times a night. And then I remember getting up at 4:35 so I could get work done before she'd wake up in the morning. And so it all depends on the season. She's actually been a great sleeper.
That's part of this other new baby is coming thing. Yeah. She goes to bed around 7:30 now and wakes up around 6:30, and we're just oh, well, that was fun. We're gonna be back to the every 3 hour thing here for the next 12 weeks or so, once baby comes. So it is a season and it is temporary, and having help is important, whether that is your partner or a parent or a friend. Or don't hesitate to ask for help because it is exhausting.
Yes, get help if you can. Hopefully you've got family available, or I think we hired a couple college students we found on Facebook to come and help watch these a couple hours during the day when one of us was home, even so we could get some work done. Yeah. Which was something we were fortunate enough to be able to do. But
yeah, it's hard. They're a lot. Yeah.
Yeah. Kids are a lot, but they're I think someone asked what was actually was a question online this week. Someone asked what was the thing that surprised us most the first couple of weeks? I think it was twofold. One of it was
we didn't actually know anything.
We didn't know anything. It's hard. Like you're not sleeping, you're trying to learn how to breastfeed, your baby's trying to learn how to eat. Everything's new. I can't tell you how many times she asked me like, hey, what's supposed to happen? You're the pediatrician. I was like, I don't know.
And we're doctors, right? I'm an OB. He's a pediatrician. And I'm like, so do we put Desitin and Aquaphor on? Like how much do we do here? Just like, is this normal? Should we wake her up?
Yeah.
Should we let her sleep?
Yeah.
Do we need to feed her again? Is she eating too much? Is she eating that is the first, at least with the first kid. Yes. I'm hoping with the second one, maybe it'll feel like
your baby's never eating too much in the first couple months of life. They like self-pace themselves for that question. But I will say
even with bottle feeding, or you're saying with breastfeeding?
Breastfeeding babies will pace themselves. In the first month or two, bottle fed babies are really not going to overeat.
Okay.
There's some data literature about giving baby large bottles as they get older, kind of a couple months of age, that if you are always giving them a giant bottle, then they eat that and they can eat to excess and get excess of calories.
It was definitely true with the boob. Your baby's not going to overfeed on the boob. That baby's hungry, put them on the boob. But I was curious about the bottle
fed babies. There is a potential as they get older to overfeed them,
and there is a potential if you are pumping breast milk and your kiddo is going to daycare, that providers, whoever's taking care of your kid, is giving them too big of bottles. Babies for the first 6 to 9 months of life really only need 24 to 30 ounces of breast milk a day. And so that can be divided up, whatever works for your kid. But so it's about 1 to 1.25 ounces of milk that your kid needs that mom is away from them. Per hour.
Yeah. Yes. So if they're away for 4 hours, that's 4 to 5 ounces
max. And so if you go out, you leave baby home with grandma, bless her heart, and she gives them 8 ounces of milk in the 4 hours, like that is giving them too much. And then you create this supply demand issue that breastfeeding moms often cannot keep up with. So you do, if you are breastfeeding, want to keep a close eye on the bottle sizes for when other people are taking care of your sweet little ones.
We'll say, coming back to the what surprised us most question, and I think I may have said this before, I think the other thing that just kind of blew me away as a new parent is just how wonderful it is. Talk about how hard it is, and we got lots of just wait till teething, just wait till potty, all the challenges, but each step of the process has definitely had its challenges. But I think I've been blown away by just how wonderful parenthood has been for us in terms of we're blessed. We've got a baby who's healthy, and we've haven't struggled to provide for her at all, but just what a special thing. And it's almost amazing that feelings this wonderful are can be shared by billions of people around the world who get to be parents. And so
we try really hard to say just wait till she smiles at you, or just wait until she rolls over, or just wait.
Hugs, toddler hugs and kisses.
Toddler little baby kisses. I feel at the 4-month mark she started doing this whatever, and it's just there's so many wonderful things to just wait for. There are challenges, but there are so many wonderful things, and allow yourself to soak that up a little bit once a day in the midst of feeling lost. Allow yourself to just be look at this sweet little baby. I'm going to kiss his head and smell his little neck and eat his little toes, and then the chaos will ensue and you'll wonder, but there is a lot of joy too.
Okay, I think we just had a ton of questions refreshing our feed. Let's try to get through a couple of these in the next 15 minutes. Maybe before we're done.
Yes, well, I just think Cece may wake up at any moment. How soon after a safe vaginal birth should a couple attempt to have their second child? Totally depends on you and what you desire in terms of family size, and people have thoughts on pregnancy spacing.
There's some data about the safest windows, right?
We have a great video on all of this. I think, what's it called? When to have
baby number 2 or
something like that. Basically,
search our channel.
We have a whole video that covers the data and the risks. Generally, we think about it around a year is the risks are ultimately minimized. But if you really look at the data, at about the 6-month mark, the really increased risks of preterm labor, small for gestational age, different things is the 6 month is where that starts to turn. Before 6 months, we call really short interval pregnancies, and that's when the risks are highest. So we really, your OBGYN is really going to encourage you to, at least wait that 6 months. We kind of think about the year, trying to get pregnant around that year mark is the sweet spot, and longer if you've had a C-section, but check out that whole video to think about risks. And some people are like, I want my kid to be 3 years old and potty trained and a little more civilized. And some people are like, we're in the thick of it. We're in the diapers. Let's just get this done. So it depends on you if you want 2 kids or like 6 in terms of how you need to keep working on that for your family. So check out that video.
Okay, a couple other quick questions. Someone, Kelsey, asked, do you suggest scheduled C-section or vaginal birth after first baby was born via C-section? We actually just answered this in a Sunday Q&A.
I talked a little about VBAC. This deserves an episode, yeah, I think. Vaginal birth after C-section is so love me a good VBAC. There is a calculator, VBAC calculator that'll talk to you about your chances of success. Your OB can sit and talk to you about, hey, why did your induction fail? Could we not get your cervix to dilate? Did you end up having a 10-pound baby? Do they feel like your pelvis is really small? The reasons, for that failed induction and different things may push you or OB one way or another to talk to you about your odds. But so warrants a discussion with your OB about your specific medical history. Know that there's a calculator, and the big risk with a trial of labor after a C-section that we worry about is uterine rupture, meaning that uterine scar rips open while you're in labor. The risk is low, usually 1% or less. But again, your OB can talk to you about that. We know that after a C-section, recovery is usually easier, shorter hospital stays. It's not major abdominal surgery. That being said, I've had friends who've had scheduled C-sections and said, this was lovely. It felt like vacation. Whereas the recovery from their vaginal delivery, they said, was just horrible. So everybody has their own flavor of recovery, and it's tough. But have a talk with your OB.
Yeah. Okay. Let's see. He says, I sleep trained my daughter using Ferber method 3 weeks ago. She still cries 5 to 10 minutes every day before bed, but she can fall asleep independently and there are no night wakings. Awesome. But is it normal? And I saw another question. Someone was asking, it still takes 5 to 10 minutes of crying before the baby falls asleep after setting down. This can be absolutely normal. There can be some things you can do to maybe help in terms of just making sure you've got a very solid routine before bed that helps them from transition. So for us, it's bath, and then we change into our diapers. We read some books. Right now we're going potty again, but then like the music changes 20 minutes before. We sing the same couple songs and put her down, and having some routine can help that transition, but also 5 to 10 minutes of them working to get themselves to sleep as they're sleep learning there is totally normal. It's awesome that you've been able to help them learn how to sleep through the night, put themselves back to sleep in the middle of the night. It's great. So yes, that is normal. It's me said, with baby-led weaning, how soon did baby Cecilia actually eat anything? I just started baby-led weaning at 7 months. Baby touches food but doesn't put it in her mouth. Totally fine. Every child's a little different.
And it's supposed to be like a fun thing.
Yep.
It's a sensory experience. They're playing with food. They're touching food. Maybe they're eating it. Keep trying different things.
Yep.
Like really, really try to incorporate different foods to find the thing that little babe likes or wants to put in their mouth, or different things like that.
And we talked when we did our baby-led weaning video, like really there's a couple signs you want to see before they're ready. Do they have the motor skills to be able to sit up, good head control, and then are they showing interest in food? The biggest thing is don't force it.
Right.
It's a fun thing. They are not getting any nutrition, like substantial nutrition, until they're 9-10 months of age at least, from solid foods. And so take your time, just let them be interested in whatever you're eating. I think it's really helpful. We always had her sit at the dining room table when we were eating dinner at night, and then she would be interested in what we were eating, and that really helped with that interest. So just keep working at it. I know that's tough advice sometimes, but it sounds like you're doing a good job just starting.
Yeah. Can you talk about your experience during labor as a support person? Anything different you'd like to do this time? My wife's due soon, so both of us are getting anxious for labor.
Yeah, and someone else liked that question too.
Yeah.
You'll have to tell me how I did the first time. I think the biggest thing, at least my mental model, my approach to that was just to like be a servant in the room, right? Like some of it is like I knew what to expect, like, oh, like this is what I've been in the room when babies have been born before, so that made it maybe easier for me. But
Sure.
I was just there by her side anytime she needed something. I
Present.
got it. Be
You were
present.
very present.
Be present. Like that is the
Yes.
best thing you can do. Like I think my back rubs did almost no good, but they were
That epidural was a life changer, though.
they were there. Like if she needed something to drink, needed something to eat, being prepared.
And communicating ahead of time kind of what your goals are from the birthing person's perspective. You know, maybe your goal is a pain medication free birth, or maybe you know you want to do the tub, or maybe you've done different classes and have worked on different pushing positions or breathing or massages or whatever. Know what we're a team. We need to have a baby. Everybody know kind of what the goals are. And then you are kind of working to support that goal for the person who is about to give birth. So like Kurt was there. He knew I wanted an epidural, and at some point he was just like, what are we waiting for? Like, what are you doing? You don't want to do this. You're not having a fun time. And it was nice to have that reminder of, hey, this was the team's goal.
Yeah.
He's here to remind me. He was just very present. Having seen lots of partners, just being present and available and being a teammate as much as you can seems to lead to the most success.
Yeah. And I will say the other thing, advice for partners out there is like, be incredibly nice to the nurses in the room. Like no one is going to be a better resource to your partner who is giving birth than their nurse. And like you just being kind and respectful to the nurse as she's doing her job, and like ask them, like they've help deliver babies every night, every day. And so they are experts, and like lean on your nurse, be like, hey, I've never done this before. How can I help my partner?
And it's your nurse who's there with you. Like
most of the time.
You're generally most of the time the OB is gonna, we'll check in on you, we'll check your cervix a couple times. But that OB is responsible for kind of many patients on that labor floor. And when you are in labor, usually there is one nurse assigned to you in active labor. So your nurse has you and maybe one other patient, but maybe not. And so your nurse is an amazing advocate and resource for you during labor. And so definitely also share with your nurse kind of, hey, these are my goals. What's available? Do you have balls? Do you have pull bars? Do we have a bathtub? Where can I walk around? What can I do? All these different things. They are a huge resource and advocate for you when you're in labor. They can be like, yeah, the water machine's just down the hall, or we can order from whatever. And they can get you the warm blankies. So yes. Let's see. So many great questions. Someone asked a question about risks and complications with a short cervix, kind of cutoff length. Where is intervention necessary? This really largely depends on your history. Do you have the risk that we think about with short cervix is the risk of preterm labor. We worry with a short cervix that you are more likely to go into preterm labor. It is something that gets looked at usually at your 20-week ultrasound. If you don't have a history of preterm labor in the past, it is not something we are screening for ahead of time. And so that is very dependent on your history. Sometimes if you have a history of what we call cervical insufficiency, it may be an indication for a cerclage or different surgical intervention. If you've had a preterm delivery prior, sometimes we think about progesterone and different medications, or if a short cervix is found at that 20-week ultrasound, which is usually we think of less than 2.5 centimeters is kind of where we're looking. Sometimes we'll start progesterone then. So that's kind of brief overview. The thing we worry about is preterm labor and preterm delivery, because that 10% of babies are born preterm, and we know there's serious morbidity associated with preterm delivery. And so it's something that we want to try to minimize as much as possible to let those babies cook as long as they need to.
Okay. One other question I thought was very pertinent to us right now. Haley said, can you guys talk about how to relieve hip pain while sleeping in the third trimester? Really struggling with that, and using pregnancy pillows. Our prenatal massage is safe. So talking about like pain in third trimester.
Yeah. So prenatal massages, yes, definitely safe. Pain, the aches and pains of pregnancy.
Someone this week had asked about like support belts and kind of your experience, like what has been helpful for you with pelvic pain, hip pain in pregnancy, what hasn't, and what is just normal.
Yes. So I am a little curious about your hip pain. Like, is it low back pain? Is it actual like hip pain? Is it symphysis pubis dysfunction in the front? What is there's so much different pain that all has a little bit different tip for helping.
And some big take homes being
big take homes. If it's kind of in the front, symphysis pubis dysfunction, like where your pelvis comes together pain, it hurts to lift up your foot, it hurts to roll over in bed, it hurts to walk. That's SPD. Things I think about when you're in bed are kind of rolling over like a mermaid. So you want to keep your feet and knees together. So you kind of roll as like a unit. You don't, kind of split your feet as you roll over. Asking for help to have your shoes tied, get some slip-on shoes, different things. There's some YouTube like SPD exercises, because doing some strength training and stretching really helps. Same thing with like low back pain. It seems a little counterintuitive, but even for your hip pain, doing some like, you're going to feel like it's wussy baby, wimpy exercises, but just doing some moving your body and some strength training really can help with this different hip, low back pain, SPD. I really struggled at the end of pregnancy with C's, like 32 weeks was just rough, and I started moving my body a little bit. I think the course I did was like the vagina coach had this course called Prepare to Push, and it was not intense exercise. It was like things on the ball, clamshell raises, like for 5 minutes a day. And I felt better. Know also that really all of this dramatically resolves with delivery. So work on some strength training and stretching. If it hurts, don't do it. Use your pillows, roll over like a mermaid in bed, get some slip-on shoes, ask for help tying your shoes or doing other things. But you have like this watermelon.
She's offered to saran wrap one in my stomach a couple times.
If there were watermelons in season, I tell you what, I would be duct taping one to his abdomen to just wear around for a day, because
my sass has not been appreciated lately.
Yes, he's been a little sassy lately, and I'm like, would you like to experience this? And
I volunteered to carry the baby many times, but she won't let me.
False offers are not helpful. Let's see. When your baby sleeps through the night, are you changing their diaper in the middle of the night? If you aren't, how are you preventing diaper rash?
Yeah, so we aren't. And as soon as she started sleeping through the night, even like she was doing kind of routinely, she would sleep 1 hour a night for every week old she was. So she was 8 weeks old. She was 9 hours a night. Your baby will pee in the night. That's okay. Generally, the pee is not terribly caustic or harmful to the skin. It's the poop and the poop-pee combo that can really be irritating to the skin. And so when we've had periods of like where she's had lots of loose poops that were pooping in the night, the biggest thing was just protecting some sort of barrier cream. So it was often we put down something with some zinc in it, like Desitin or
zinc. The purple one,
or butt paste. Either one as like treatment. The zinc really helps, and then covering it with a thick ointment, Aquaphor.
That is the thing. So if you've got a little baby who's going to be sleeping through the night, often I feel like it's just pee diapers at night. If you have a baby that poops at night, if you find that they're getting terrible diaper rash because they are pooping in the night, you may have to change their diaper.
Yep.
Okay.
Absolutely.
The things I would try before that, though, is when you get that sweet babe ready for bed, really slather on
thick layer of
your Desitin or some kind of like whatever butt paste you like, and then Aquaphor
over the top,
because
the thick ointment, not the cream,
not cream.
Lotion.
Yeah.
You're just literally making a barrier to protect the butt.
Get the big tub.
And then in the daytime, like air that little bottom out. Like every time you change the diaper, like make sure it's dry. Like if it's warm enough, get that little butt out in the sunshine.
Yep.
Like,
let them be naked.
Yeah.
Use a hair dryer. Get the butt dry. Those would be my pro tips. Usually you can get away with just thick amounts of butt paste and Aquaphor. That if you do poop at night, you're okay. But sometimes if you're in a bad cycle of bad little butt is burned, you may have to change that diaper in the middle of the night till their butt is healed. And their little butts seem to get tougher as they get older. But they have very sensitive skin and they're pooping all the time when they're little babies. So
our hour is up.
Yeah, she's still asleep. Yeah. That's a win.
So our little one's gonna wake up very soon.
Yes.
Thank you so much for joining us. Any last thoughts? I think we're planning on our own baby number 2 coming soon. So a lot of the questions that we saw this week were about preparing for a labor. We're going to do a video on what's in our hospital bag now that it's time number 2, going kind of week by week through like having a new baby in the house this time, what it's like for mom, what it's like checkups for baby, and trying to do that much like we did for pregnancy with the first baby. We're going to try to do it with
the newborn.
Parenting baby number 2.
Yes, we think that'll be fun.
Gosh. Pray for us. Hopefully we're able to do that.
No, we can totally do it. And just so this little guy doesn't look back and be like, well, you love Cease so much more than me. You documented every single week of pregnancy with her. I think I've taken one bump pick with this one. So just busy. But look for some pregnancy, preparing for labor content coming, preeclampsia. The episode, I think maybe for this week, we're thinking about getting our hospital bag ready. We've got an episode on subchorionic hemorrhage because that's a question that comes up all the time. Just lots of different fun stuff, and then sharing new mom life again and all the baby milestones that are coming. So please continue to leave us comments.
Yeah, we see them. We can't always answer them all. We get a lot, but we try to answer them when we get a chance to sit down and do that. But we do see them.
Then we know what you guys want to see, because as always, we want to provide educational information for you that's hopefully somewhat entertaining. And please let us know what you want to see, and we will keep working on that for you. So thank you all for being here. This is a riot, and now we will, maybe we'll get another 5 minutes before she wakes up.
I guess.
Have a great week.
I think we lost our stream.
And